Hi, good night, guys. So this video will be on communication skills for the Mrcs examination. So one of the most common reasons that persons actually fail the examination is due to the communication skills station. And it's not that we don't know how to communicate, it's just that, you know, most of us have workloads that are way more difficult than we can manage most times. So eventually a lot of our skills actually gets a little shabby. So here's a little refresher course. For one, never forget to introduce yourself to the patient. Introduce yourself, and then you tell them, well, if you want, you can say, well, my name is, so for instance, my name is Dr. Cisnet. You can say, well, my name is Dr. Cisnet, but you can just call me James. What is your name? And then you said, how old are you? Where are you from? What brings you here today? You start the conversation like that. That's for the history stations and the breaking news stations. Well, for the breaking news station, they're actually going to tell you what they want from you. So they'll give you a case, and they'll say, for instance, the person, well, for my station, it was a situation where the person had like cancer, right? And it was after biopsy, you have to break bad news. But it can also be a situation where the person has to, for instance, the person's blood sample was lost, and the usual stuff. The person's blood sample was lost, and you have to break the news that they have to retake the blood, and the person's is terrified of needles, right? So from that point of view, there are two approaches you have to take. So for the cancer station, make sure that you take at least an hour. Not an hour. What am I saying? You take at least a minute, sorry, to get into the demographics, just get a feel of the patient. It's going to be an actor. And trust me, they act really well too, because like some of them even cry, some of them get frustrated. Don't let that throw you off. You have to stick to the basics, because some patients are going to, like in the real world, some patients are going to cuss you out, some patients are going to get violent. You just can't predict it. So for instance, when the patient starts to get more irate, you're gonna keep being apologetic. I'm so sorry. We apologize. This is for the lost sample, but for the cancer station, you're gonna say, we are going to be with you along the way. We're gonna offer you as much support as possible. We have a great team of doctors. And you have to offer reassuring advice. So you're gonna say, whatever is possible, whatever we can do for you, we're going to make sure that we follow you through every step of the way. We're so sorry that the news is not positive, but we need to make sure that you get the best care possible. And you keep saying, I'm so sorry. I am lost for words. I just don't know. Don't say I don't know, but I just wish that the news was more positive. But we are going to be with you along the way, and you make sure that you create the environment of empathy and support for this patient. For the station with lost sample, you have to say, I am so sorry these things happen. It's a medical mistake. We are on behalf of my whole team, we are so sorry that we lost the sample, and we're so sorry that we have to take the sample back over again. And you have to ensure that you tell them that that it's very important for the sample to be taken again. So you need to let them know, well, even though we have to stick you again, please know that we're not doing this, that we are doing this for the betterment of you, because we want to make sure that you get this test done, and we know what's going on with you. I'm so sorry that we lost the sample. Please accept our apologies. And you have to make sure that you explain this to them. Empathy is a big thing. A lot of doctors lose it, but we have to make sure you get that empathy and sympathy across to them. Okay. For the station, there's another communication station that can come to, which is the station dealing with the telephone call. Not too certain there's a high failure rate with this station, but once again, it's communication. If English is not your first language, make sure you talk very slowly, very deliberately on the phone, because one thing that can happen in medicine is that there can be a loss of information from you speaking to another person. The person on the other line will probably be very good at English. English might not be their first language. You'll never know. So they'll give you a case. I had a kind of a fake case. So for instance, they'll tell you I did this in one of my videos, but someone asked me to do it back over again. So I'm going to make sure that I get my point across. So they'll give you a case. Might be a person who's post-op. They'll give you a sheet with all of the vitals. So like temperature, pulse, respiratory rate, SpO2. They'll tell you that the nurse called you to the ward, and your consultant's in theater, or your registrar is in theater, and you have to call them and relay the information to them. Now, when you relay the information to them, they're going to ask you specific questions. So they're going to say, for instance, they're going to be, hello, and yes, my name is Dr. Assistant. We have a patient on the ward who I was called to by the nurse. After you do this, you're going to give a summary. So this patient's name is, for instance, George Jefferson. You're going to say the patient's name is George Jefferson, and there's a 72-year-old male who is post-op. Complains that the nurse is stating that he has shortness of breath. On examination of the patient and approaching the patient, I found that this patient after doing ATLS, which would be airway, breathing, and circulation, this patient's airway was patent, but the breathing was increased. There was air entry bilateral and symmetrical, but however, I'm just giving an example. Decreased inspiratory effort. The cardiovascular examination was normal. You know that I passed 2 large bore IVs. They probably tell you that they did all of this before, but 2 large bore IV were passed on the ward. However, on trying to resuscitate the patient's blood pressure did not move. I examined the patient's abdomen, was normal. I also called for help, ECG, the usual stuff for the ATLS. My consultant actually asked me which one thing that I actually really miss, but I never miss again, is that they ask you, okay, so what do you think it is? I think the patient might have an MI. It's possible to have a pulmonary embolism because it's post-orthopedic procedure. So there's an increased risk of pulmonary embolism as well too. You have to say, the person might ask you, did you examine the calves? Was there any calf tenderness? It might be written, but you have to remember to examine calf tenderness as well too, because you might miss it too. There are little details you might miss. So if the patient has calf, they're not going to say that the patient has calf tenderness, but they ask, unless they put it in the actual case. So you might have to say, well, should you examine the patient's calves? And then they'll ask you something like, okay, do you think that they should leave theater to come to see the patient? And you will say what? That's the question you have to really sit down and put in your mind. What will you say? So in my examination, I actually said, yes, I would like to come and see the patient. But in the interim, I would like to refer the patient to the pulmonary team, as well as initiate, the high flow oxygen, keep monitoring the patient's vitals, ensure this patient is stable. But you need to inform the pulmonary team or the internal medicine team, depending on where it is. The PASI Mrcs might give some other suggestions too, but you have to make sure that you inform everybody, okay? And you have to have a high suspicion for pulmonary embolism in these patients. Pulmonary embolism, MI, those are the top two. And then if it's a pulmonary embolism, you have to find out where is the source. Is it a DVT? Things like that. Okay. Hope this helps. If you have any more questions, you can leave a comment underneath. Subscribe to my channel. Hope all is well. Next video will be coming just now.